When Steve Barnett learned he had colon cancer in 2012, he wasn't ready to meet his maker, so he prepared for the battle of his life.
Dr. Gaw prescribed that I would take about 6 or 8 weeks of chemo and radiation. Unfortunately, she had to take all of the rectum and a fair portion of the colon.
The treatment was successful, but in losing a piece of himself, Steve also found he lost something else: bowel control. Some studies show more than half of people treated for colorectal cancer experience some degree of bowel incontinence at least once a week.
It is actually more prevalent than people think. It's just that it's one of those taboo topics. Nobody wants to talk about it.
The inability to control his bowels pushed Steve to the limit.
I go to bed, have to get up. All done, go back to bed, have to get up. It was just constant, and nothing got any better.
Getting rid of the cancer is not an endpoint for everyone. Coping with the complications presents a new challenge. When it comes to bowel control, doctors have a deep arsenal.
We try to bulk up their stools with fiber supplements. Sometimes we try to constipate people with anti-diarrheals. And then we also send them to biofeedback therapy.
When none of these provided relief, Steve opted for an implantable nerve stimulator.
I describe it as kind of like the pacemaker for the pelvis. And it's probably the size of a small stopwatch. It's flat, and it will be permanently placed just under the skin and fat around the buttocks.
The same stimulator has been used for years in bladder control. Now it's approved for fecal incontinence.
It's there, hardly feel it, hardly know it's there. Now I can go out and not worry.
For Steve and others like him, it's restoring rhythm in their life. For Lee Memorial Health System, I'm Amy Osher.